I myself am a board certified physician, as is my partner. Both of us have practiced emergency medicine for over 20 years. We have combined over 40 years experience administering ketamine. In addition to that, we have extensive experience in dealing with patients with mental health issues, mental health crises, and combining those two, we provide what I would say is unrivaled expertise in the administration of ketamine for mental health disorders.
We decided to have an exclusive practice here at KMD for ketamine, to give that to patients with mental health disorders and chronic pain because of what we've seen through the course of our careers. We've really seen people in mental health crises. We've seen people dealing with chronic pain all the time. And it's frustrating to us to see what people go through. And for us to have an avenue to affect change, to help these patients in a way that we can't do in the emergency department is really, quite frankly, unbelievable. You cannot have a good ketamine experience without having a good connection with the staff at a clinic. So here we have not just the most qualified providers, and that goes from our patient advocates, our patient practice concierge, our nurse practitioners, our medics, and our physicians. Our entire group of providers really works to go that extra mile to connect with patients, to develop a personal experience with those people that we're treating.
The staff at KMD Wellness is not only extremely professional, but extremely compassionate. And being a part of KMD Wellness really feels like my calling.
We create a very comfortable, safe environment for patients. We want them to feel connected to the providers here. We have essentially open access. We're not a 9 to 5 type of practice here.
Having a doctor who is experienced in the use of ketamine, as well as being very familiar with mental health issues, mental health crises, is extremely important.
One thing that I guess brought me here is that time and time again, especially in the emergency room and in the hospital, I've seen mental health, and it's come up time and time again, and over again we treat the chronic illness and we discharge them. But a big part of healthcare that we miss is mental health. And there's not a focus in the hospital system or in the healthcare system for mental health. And so here at KMD, coming in here, we focus on mind, body, soul, and everything that is a person, and bringing a person to a better life and a quality of life that they couldn't have before.
We've had patients say things to us that move us all here at KMD. Things like, I don't remember the last time I've laughed. And yesterday, I found myself just laughing at my dog playing. And when you hear that, you realize you're doing something right.
So walking in here, every day when I come to work, I love it. I feel like I'm walking into, I can almost take a deep breath at the door and come in here and feel calm and feel safe and feel welcome. And I think that everyone here has made me feel welcome, and I love sharing that with the patients and with the other providers.
It just makes our hearts happy when we see that the progress that these patients have made. A lot of times when they come in for their first infusion, you can just see their body language, and they're depressed and anxious and scared, and they don't know what to expect. And their days are not filled with a lot of joy. And so when they're able to start feeling that joy and start living life, and again, like we're by their side, we're a part of it, and so you can't help but form bonds with every one of our patients.
In this situation, we get to see patients from the beginning, where they start, when they come to us with their issues, and then be able to treat them, establish a relationship with the patient, a personal relationship, be able to communicate with them throughout their course of treatment, and then really to form a bond with them as they begin to sort of grow out of the crises that they're in, and watch them, as they are able to sort of come alive again. And it's really unbelievably rewarding, both from a professional and a personal standpoint.